Assalamu alaikum. I'm Dr. Abdullah. Our lecture today is about the clinical anatomy of the ventricular system and the most important clinical point and anatomical point in the ventricular system of the brain. As you know from your theoretical lecture, the ventricular system consists of the following ventricles: the lateral ventricle, and the third ventricle, this one, in the midline, and the fourth ventricle. These ventricles interconnected between each other due to CSF circulation. The CSF circulation starts in the lateral ventricle, then it will pass to the third ventricle through the interventricular foramen of Monro. As you see here, the connection. We have two interventricular foramen and one third ventricle. So the CSF may be produced in the lateral ventricle and it will pass to the third ventricle, and from the third ventricle it will pass to the fourth ventricle through the cerebral aqueduct, this one, that connects the third and the fourth ventricle. Now we are talking about the location. Where is the ventricle are located? As you know, the ventricle mainly consists of the conformance of the following layer: the epidyme, the pia mater, and the capillaries of the vessels here, all are connected to form the choroid plexus. The choroid plexus are formed in the all ventricles. So the CSF is produced in all ventricles, but mainly in the lateral ventricle, large amount, and to a lesser amount in the third and fourth ventricle. As you know, this is the lateral ventricle, consists of C-shape lateral ventricle. This is the posterior horn, this is the posterior horn, and this is the inferior horn, this is the anterior horn, and this is the body of the lateral ventricle. This is the body of the lateral ventricle, and this region we call it the trigone. As you know, it is the convergence of all these processes. When we talk about the normal anatomy, the posterior one, the posterior horn, normally it is not found in all subjects, but if it is present, it will be embedded within the occipito-parietal lobe, where the inferior horn is embedded in the temporal lobe and the anterior horn is embedded in the frontal lobe. And this is the body. So, what are the nearby subjects that we found here? We mentioned that the anterior horn is embedded in the frontal lobe. So it is bounded by the corpus callosum, septum pellucidum in this region, and it is inferiorly floored by the head of the caudate nucleus. The body region, this is very important. Why? Because it is floored by the groove here that formed between the thalamus and the caudate nucleus, the body of the caudate nucleus. So the body of the caudate nucleus is flooring the body of the lateral ventricle. This is the body region. This is the trigone, this is the posterior horn, and this is the inferior horn. These regions are situated between the calcar avus, this is the posterior horn. The calcar avus form a bulge on the posterior horn, and it is on the bulge on the inferior horn. And the inferior horn is floored by the hippocampus region, where the posterior horn is floored embedded within the occipital lobe. So, this is the normal anatomical position of the lateral ventricle. Now we talk about the normal position of the third ventricle. The third ventricle is a slit-like structure in the midline, situated between the thalamus and the hypothalamus laterally and the interthalamic adhesion, and anteriorly it is limited by the anterior commissure and the lamina terminalis. Posteriorly it is limited by the pineal gland and the Hubner commissure and the posterior commissure. And normally the third ventricle contains a foramen here. This is not the foramen of Monro. No, this is the foramen for the passage of the thalamic fiber to form the interthalamic adhesion. the thalamic fiber for the formation of the interthalamic. So you see now the pointer is in the thalamic foramen within the third ventricle, but this foramen is the foramen of Monro. Here the interthalamic foramen for the passage of the interthalamic adhesion. This is important to distinguish between these, and these are the foramen of Monro that connect the third with the lateral ventricle. Now we talk about, this is the cerebral aqueduct that connect the third and the fourth ventricle. What is the function of this layer, of this part? For the passage of the CSF from the third to the fourth ventricle. So the normal circulation we mentioned, from the lateral to the third to the fourth through the cerebral aqueduct. Now talk about the fourth ventricle. Fourth ventricle, it is tented shape, like the tent. The floor of the upper part forming the floor of the pons. The pons are the medulla oblongata forming the floor of the fourth ventricle. Upper part formed by the pons, the lower part formed by the medulla oblongata. And these are the processes of the fourth ventricle we mentioned now. This midline forms the foramen of Margini. We talk about when the CSF comes from the lateral ventricle to the fourth ventricle, it will pass from the fourth ventricle into two spaces, the subarachnoid space and the central canal of the spinal cord. To pass to the central canal of the spinal cord, it will pass through the orbits, as we mentioned in the previous lecture. But when it will pass to the subarachnoid spaces through three foramen, one in the midline and two lateral foramen. So this one is the foramen of Margini in the midline, and these are the foramen of Lodgkin, two lateral placed foramens, to allow the passage of the CSF from the fourth ventricle to the subarachnoid space. So we talk about these points. Why we mention that? Because sometimes these points will block. There will be a block in the passage, or an increase in the secretion, or an increase or decrease in the reabsorption of CSF. All these situations will lead to the dilatation of the ventricular system, the whole dilatation of the ventricular system. So what we call the hydrocephalus. حالة كلش كمان خاصة بالأطفال حديثين الولادة يجون ventricular system dilated. Why? Because there is a block either in the passage for CSF with foramen of Monro, this one, or the cerebral aqueduct, or foramens of the fourth ventricle, as we mentioned. This type we call it the obstructive hydrocephalus, and it is very common. So this is all about the ventricular system, the most important clinical point we mentioned. Thank you.